So this is for IV tubing priming for a primary and a secondary line. So we need to first to make sure you have the appropriate fluid that the doctor ordered. So you want to make sure that if the doctor ordered port 9 normal saline that you have it. If you ordered 1,000 cc's that you have that right amount. You want to make sure that you check the expiration date on the fluid. And as you open it up, and these have separated areas here to open up your tubing, you want to take it and take a good look at your tubing. To make sure that there's no particulate matter, you can go ahead and just move it and agitate it a little bit. Make sure there's no particulate matter in there. Make sure it's not cloudy at all, that it seems to be completely intact. Okay, so this is 0.9 normal saline. Expiration date of February 12th, so this is expired. We wouldn't give it to a patient, but we are going to use it for this kind of purpose here, but that's where you find your expiration date. I'm going to go ahead and set this down on a clean surface, or I can hang it on my bag. So I'm going to go ahead and I'm going to put my IV bag up on the IV pole. I haven't opened it yet. I have this everything ready to spike. I can go ahead and take this off now using the aseptic technique. I'm going to hold this port down. This is the 2 ports on here. One is to add medication, the other is for the IV set. I'm going to pull this port here out, and nothing is flowing because there's a little area inside here I have to pierce. I'm going to be careful I touch just the inside of the area. I'm going to take and I'm just going to manipulate, kind of screwing it on to get it all the way inside. Okay, you can see how it's connected here. I'm going to lower down just a little bit. You can see nothing is dripping because I have my roller clamp closed. I'm going to go ahead and just fill my drip chamber 1/3 to half full, and most of them have a little marking on here so you know how high minimum to fill it up. I'm going to make sure then that all my ports here are inverted, and the reason I do that is so that as the fluid travels up, air rises. Okay, so as that fluid fills up, it's going to go down here, push air up, and I'm going to get less bubbles in my tubing. That includes the one-way valve here. So I'm going to open just slowly here, waiting for that to go. And as I fill it up, I can go ahead and lower down just a little bit. Again, all my ports are inverted, and ideally, and if I have air in the tubing, which I can already see I do have some, I'll show you how to get that out. I'm going to go ahead and finish my priming. I'm going to hold it over the end part here so that as it drips, it's going to drip over into the garbage can or over into the sink. Now, once it comes out the end, it's been fully primed. I'm going to reassess my line here to see if I have any bubbles. And if I have bubbles, such as one I have down here, and you're going to entangle my tubing as well, and check for bubbles, check for bubbles, check for bubbles. Do good. Oh, I got a bubble here on the end. So as I have a bubble here on the end, I have a couple of options. If it's right toward the end, there's not that many milliliters of fluid in here. I could just open up this port and allow it to drain over into the sink or into the garbage can. I can also, so I don't waste fluid, kind of tap, tap, banjo strum, try to get that air as close as I can to the end. Okay. And then again, opening up that roller clamp, go ahead and pry the rest of that out. Okay. Once I double check and make sure my IV is free of bubbles, I can go ahead then and safely attach it to my patient. Okay. So I've primed my fluid all the way through. I'm ready to attach it to my patient now. I'd want to make sure that I clean the end port of my saline lock. I'm going to take an alcohol prep pad or a chlor prep and rub 10 times, 10 seconds to clean that end. I'm going to disconnect from my port here using aseptic technique. I'm going to attach it to my saline lock and lower lock that on. Just screw it on. Again, any caps you take off, make sure you throw them away so it doesn't get in the patient's bed and cause problems. I'm going to open up my saline lock here to my patient, and then I will take and open my roller clamp here to have my IV fluid flow in. Now this is where we're going to go ahead and start to count the drops. So I've attached this to my patient. I identify that it's a patent IV and that this IV flows when I have the roller clamp opened up. I can then go ahead and adjust my drip rate using my watch and the roller clamp here to adjust the flow. So I've done my calculation. I know that my drip rate Given my milliliters per hour and my drop factor, I want to do at 42 drops a minute, so I don't waste time and count for a full minute to realize I'm off. I'm going to think 42 divided by in half, so it'd be 30 seconds, would be about 21 drops. Half of that would be about 10 drops. So I'm going to go ahead and sit and just adjust the flow rate here with my roller clamp. Okay? So now I'm going to go ahead and just adjust my roller clamp here as I count on my watch here. So I'm going to pick a number to start at. So I'm going to start at the 9 and start counting. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hasn't even 10 seconds yet. I know I'm too fast. I'm going to slow it down. I'm going to wait till a number I can start easily counting at. I'm going to get again 1, 2. That's too slow. I can already see it. I'm going to adjust again. Pick a number and count at 1, 2, 3, 4, and so on. That just gives you an example of counting. You want to count until you have, if we're ideally looking for 42 drops a minute, until I have about 10 and 15. I double check it to make sure I have at least 21 and 30, and then I'm done and ready set to, I'm infusing appropriately. So now we're going to go ahead and set up a piggyback line. My line is patent, it's infusing, but now the doctor has ordered piggyback medication. So again, same thing is applied. I want to make sure I have the right medication for the right patient, right route, all your 6 rights. Make sure that the medication or the IV fluid here is not expired. I'm going to open up, same thing, it's serrated edge here. I'm going to go ahead and pull it open, taking out my fluid, checking for any particulate matter, cloudiness, making sure it's not expired. I'm going to go ahead and open up my piggyback tubing. The piggyback tubing, you can identify, it usually has a little device here to help set it up. Again, serrated edges, you're going to go ahead and pull that open, tab off, pull out your piggyback tubing. A couple of things that make this tubing different. One, it has a device so you can set up your piggyback. Piggyback, someone gives someone a ride. So what I'm going to do is take my device, my hanger, and hang my primary bag low. My piggyback is going to be given a piggyback ride on top of the primary line. I'm going to go ahead then and open up my tubing here, taking off my tape here. Before I do anything else, I'm going to make sure I close that roller clamp. Anytime you open up tubing, close that roller clamp. You'll notice on this tubing there are no ports. So priming is a lot easier for piggybacks. I'm going to take it again, good aseptic technique. I'm going to pull the top off of my piggyback, top off of the spike of my IV tubing, and I'm going to pierce it, kind of screw it in, again making sure I don't poke myself. I'm going to hang this up high. Again, nothing is flowing yet because it's been, roller clamp is closed. I'm going to hang it above, piggyback, someone's giving someone a ride. I'm going to fill my drip chamber, again, a third to half full. Again, it has a marking on here as well. And I want to hold it over a basin or somewhere else, a sink, so that when I prime it, I don't drip anything on the floor for safety. Now, this has no ports in it. It's going to go quite quickly, so you want to take your time to go slowly. Okay, and you don't waste medication. Double check to make sure there's no bubbles. And now you're going to take and attach it. Where you're going to attach it is to the port that is closest to the IV tubing itself. So this actually is old tubing. I need a special device to attach it. This would ideally be inside of a packaging area here. Okay. This device is acts like a clothespin. It's going to be a little adapter. I'm going to take, again, I just swab this top again. I would take off the area that's covered and pierce it through, so now it's attached. Again, my piggyback is being given a ride. Now, if I open this up, ideally, once I have everything attached, I'm going to close my primary. Nothing is flowing. If I open up my piggyback here again, nothing is flowing, and that's because my primary is the one that calls the shots. When I open up my primary tubing here, my piggyback starts to drip. And now using my primary roller clamp, I would adjust my flow rate based on a calculation for I want this to run. Now the thing you have to be cautious with in real life is if I primed my piggyback here and I've set my rate for this to infuse at a certain rate, when this is done, gravity pressure will take over and this bag will start to infuse. it won't necessarily be at that same rate because of gravity difference and weight difference there. So you just need to be aware of that. If I said that this is going to go in over a half hour, I want to make sure that I check myself and I come back in a half hour, because they may or may not want the fluid from this bag to go into the patient if they're on like a fluid restriction kind of thing. Once I've shown that my piggyback is running, and I always want to make sure that it is dripping sufficiently before I leave the room, I could go ahead and then leave the room and set up your piggyback appropriately.